Alhamdulillah, wassalatu wassalamu ala rasulillah, ma ba'd. The last point in chapter of purity, Nifas. Bab and Nifas. Nifas, it means the postpartum bleeding, the blood which comes after giving birth. When the mother gives birth, there is blood. So this is called dam and nifas. This is called dam and nifas. There is hadith اللي هو كانت سلمة رضي الله تعالى عنها said كانت النفساء تقعد في عهد النبي صلى الله عليه وسلم بعد نفاسها 40. It means the نفساء used to stay at the time of Rasulullah صلى الله عليه وسلم 40. It means staying as يعني not praying, not fasting. 40, it means 40 days. رواه this hadith narrated by الخمسة إلا النسائي. Okay, if you remember, we say this hadith narrated by the five, it means Imam Ahmad, Abu Dawood, النسائي, Tirmidhi, Ibn Majah. Okay, so this hadith narrated by الخمسة except النسائي. طيب. The scholars say the rules of nufasa exactly like the rules of al-hayd, the period, except for the puberty, al-bulugh. Okay, يعني they say nifas is not a sign of puberty. Why? Because already if she is pregnant, this is a sign of puberty. Okay. This is one issue, and also it is not a sign for al-iddah. It is not a sign for al-iddah. You know, al-iddah, this is after the divorce. Okay, it is not a sign of iddah, or after the death of the husband. It is not a sign for the iddah the end of the iddah. Why? Because the sign is giving birth is the end of the iddah. Giving birth is, for example, if the lady is divorced during the pregnancy, okay, when she gives birth, the iddah is finished. She will not wait until the postpartum bleeding finish. Giving the birth. طيب, the issue, one of the issues the scholars mentioned, the minimum days of nifas. Okay, the hadith here by Salama, she said the woman used to stay 40 days for the nifas time. طيب, some scholars say this is authentic hadith, like Sheikh al-Albani, like al-Hakim. Others say it is not authentic. Okay. So she said 40 days. طيب, should we take the 40 days خلاص? No more nor less? Majority of scholars said whenever, okay, if we talk about the minimum time, whenever the woman sees the purity, then she should start praying and fasting. If you remember, what are the signs of purity? We mentioned two things, صح? القصة البيضاء والجفوف. The white discharge, and number two, dryness. Okay? So if the woman, okay, so this one of these signs, then she has to start, of course, to take a shower. She has to make ghusl. Then she should start praying. And if it is Ramadan, she has to fast. Fast. Okay, of course, if she is not breastfeeding the baby. طيب, so they say when she sees the purity after 25 days. Nowadays, subhanallah, many women, maybe most of them, becomes pure or the blood stops before the 40 days. Why? Because subhanallah, in the hospital now, okay, they clean the the uterus of the woman, and maybe some of them take some kinds of medicine, okay, or some of them they do a procedure to clean them. Okay, so that's why, subhanallah, many women after maybe 20 days, 25 days, they are pure and they start praying. Okay, so if she's pure after 20 days, خلاص, we tell her, yes, now you have to make ghusl and you start the salah. Okay, what about the cesarean section? Okay, the baby is not from the womb, from the normal delivery, it is abnormal from the stomach side. Okay, but still there is bleeding, but less. Okay, yes, we consider this as a nifas, of course. She is in the nifas period. Okay, but it will be less, maybe 10 days, 20 days. Even the scholars say, or some of them say, if the birth without bleeding, okay, this she has to pray, or maybe bleeding for 1 day. If it is cesarean section, okay, and they clean everything, and the blood was coming only for 1 day, then after 1 day she is dry. Khalas, we tell her, yalla, you have to pray. Just yesterday I gave birth. The issue with the blood, are you bleeding or not? Well, I stopped because they did everything during the operation. Khalas, you have to pray now. So as a minimum, okay, we don't have a certain number of days. The other issue, what is the maximum number of days? Okay, here Salama mentioned 40 days. So some scholars said, khalas, we should stick to the 40 days mentioned by Salama. Alaykum salam. Salama mentioned 40 days. So we have to stick to the 40 days. We should not do more than 40 days. Even if she is bleeding. She is bleeding? Yes, she is bleeding. How many days? Now 41 days. No, khalas. Up to the 40, the day 40, she has to make ghusl and to pray. Other scholars said 60 days. Okay, like Imam Malik wa Shafi'i. Of course, يعني, when you read the hadith, Salama said, كان النساء النفساء تقعد. The lady, Nufasa, means the one who's bleeding after giving birth. She was waiting 40 days. They said, Salama did not say this is fixed from the Prophet sallallahu alaihi wasallam, but this was common. That the woman after giving birth bleeds 40 days. Okay, this can be more and this can be less. But this was common, that the woman bleeds 40 days. So if she is bleeding more than 40 days, for example, 47 days, khalas, we consider this. You see the same blood, the same criteria of the blood, khalas, you should stay as nufasa. Don't pray and don't fast. Don't pray and don't fast. So if it is 40, 42, 45, 50, okay, so we consider this as nifas. So she should not pray and she should not fast. But of course, she should make up the fasting days. It is Imam Malik, Imam Shafi'i, and also one opinion of Imam Ahmed, rahimahullah, that the maximum is 60 days. The maximum is 60 days. خلاص, this is istihada. This is not she has to pray. She has to pray. She should not stop praying more than 60 days. طيب, when can we consider this as a nifas or not? يعني if there is miscarriage, can we consider this nifas or not? The first thing Sheikh Mathaymin said, if the miscarriage was nutfa, you know the stages of the baby, nutfa, alaqa, mudgha. Okay, what is the meaning of nutfa? It's a piece of clot blood. So the first thing Sheikh Mathaymin said, if it is a piece of clot, nutfa, okay, we don't consider this as a nifas. Okay, يعني for example, she is pregnant now, the second week, then there is miscarriage. No, this is not nifas. Still, this is nutfa. He said this is agreed upon by the scholars. We'll tell the lady, if she sees this blood, we tell the lady, you have to pray and fast, because this is not nifas. Still, this is nutfa. So we agree on this point. The second point that we should agree, Shaykh Mathaymin said, if she has the miscarriage after 4 months, the age of the baby, okay, is 16 or 17 weeks, يعني 4 months. He said, خلاص, we consider this as nifas. After 4 months, this is nifas. Definitely, this is nifas. We tell this lady, don't pray and don't fast. You are nufasa. The issue, if it is between the nutfa and the 4 months. Then he said, if it is alaqa, you know the stages, nutfa, alaqa, mudgha. نطفة, علقة, مضغة. طيب, it is الأحناف and some of the Shafi'iyya, or one opinion of Shafi'iyya, and also which is famous among the Hanbali, okay, this is not considered as nifas. It's not considered as nifas. They said, why? Because the alaqa still, it is a blood. It is not a baby. Alaqa is a kind of blood, clotted blood. It is not a baby. The fourth point, if it is the level of mudgha means it is bigger. What does it mean mudgha? It is something that you can chew by your mouth. Mudgha, yamdugh. What does it mean mudgha? From the verb yamdugh, to chew something. So it means it is not, of course, not the piece, the size of fist, less. Something for the mouth size. Okay? And you can see the lines as a human being. Okay, this is the arms, the head, the legs. Okay, they say تبين خلق إنسان. You can notice this is a human being. Okay, most of the scholars say this is nifas. Most of the scholars say this is nifas. But if it is mudgha, but you cannot notice the lines as a human beings, then this is not nifas. Okay? Huh? No. We are talking before the 4. If it is after the 4 months, khalas. Now we are talking about before the 4 months. And also, he is not nutfa. We are not talking about the first month. Okay? We are not talking about before the 40 days. We are talking about between the 40 days and the 4 months. Okay? Because there are stages. مضغة depends. مخلقة وغير مخلقة. If the مضغة مخلقة, you can notice that he is a human being, then this is nifas. But it is mudgha. But as I said, you cannot see the the picture of the human beings, then it is not nifas. Huh? يعني they did not mention exactly, but alaqa, it is يعني a piece of blood. Piece of blood, they cannot notice anything. They cannot notice يعني a skin. Like that. يعني there is another issue يعني when he is a human being with روح. Okay. يعني the famous hadith, maybe if you remember, hadith Abdullah ibn Mas'ud, 40 days نطفة, then 40 days علقة, then 40 days مضغة. Okay. يعني some scholars said 40, how many days? 120, it means 4 months. Other scholars said, no, the hadith doesn't mean 40 plus 40 plus 40. The hadith means within the 40 days he is nutfa, and within the same 40 days nutfa, then alaqa, then mudgha within the same 40 days. Why? They say because also there is another narration, only 40 days. The Prophet ﷺ mentioned only 40 days. Okay, يعني they say نفخ الروح, when he is a live human being. Some scholars said after the 4 months. Other scholars say no, it is after the 40 days. After the 40 days. And also they mention, what is the meaning of 40 days? How many weeks? 6 weeks. Okay, and subhanallah, when you can hear the heartbeat, 6 weeks. صح? Or you don't know? Habibi, you don't join your wife when she is pregnant? Huh? You don't join your wife? You go with your wife? Or you, no, I don't care. How many of you join the wife for the follow-up pregnancy? شنو؟ Brothers, it is important to be with your wife when she follows up the pregnancy. Okay, even during giving birth, it is important. Do you know or not? Psychologically, it is important for the wife for giving birth to make it easier, inshallah. Emotional support. Habibi, I'm not talking about Kuwait or India. I'm telling you something. I'm telling you a fact. You accept the fact, you don't accept? Yes. Yes. Private. I don't I don't recommend the government. This is the government is a mushkila. Here they don't respect the process. Medically, I'm talking about medically, and of course also Islamically it is totally corrupted. A big problem. Subhanallah, the woman. Not only that. They don't respect the woman as a human being. I will not say as a Muslimah, as a human being. They don't respect. 4 ladies inside one room. This lady is shouting, and this lady is waiting, and this lady. One room. 4 beds in one room. It is not allowed to use the mobile. I remember this before 20 years now. I don't know if they change it or not. Allah alam. Okay, but I remember that. Wallahi, this is a problem. Why it is not allowed to use the mobile? She wants. Also, it is not only the husband. It is not allowed for the mother or the sister. It is not allowed for anyone to join the lady. Why? You see the cleaners going inside. I hope that I'm cleaner now. Well, I remember one of the mothers. Okay, she was waiting. her daughter inside. What is happening inside? She doesn't know. Wallahi mushkila. She doesn't know what is happening to my daughter now. And she's looking the cleaner going. She said, I hope that I'm a cleaner. Wallahi, this is a disaster. Why it is not allowed for the, okay, if you don't like the husband because they are all of them ladies, okay, at least the sister, the mother, a close friend, she needs a support. I mean, Islamically, this is wrong. Yani the lady, she's inside, and also they are preparing the lady for giving birth. It means without hijab. Without hijab. Why? Because you should be prepared for birth. So of course your niqab will not be with you. It is only a curtain, and doctors enter without rules. Who said that? From where? Is it written in the Quran? There is an exception for the doctors? Even in medicine, I mean the rules of medicine, okay, the doctor should take permission. But the problem, many doctors don't follow the rules of Islam, and also they don't follow the rules of medicine. Taking medicine, I am a doctor, why should I? Open the door, yallah. Maybe if he's a good doctor, then he will enter. He will not wait. Khalas, I knock the door. Habibi, they are women. She's outside, she is with full hijab. And inside the hospital, no rules. Some of them have the concept inside the hospitals, no rules for hijab. Why? Because this is darura, emergency. Who said that? Who said that? Subhanallah. This is a mushkila, a big problem. I will not say only in Kuwait. Everywhere. What I know, everywhere. They don't respect the awrah. They don't respect the awrah. Okay, maybe for the non-Muslims they respect. Why? Because they are afraid. Maybe خلاص, no. But for the Muslims, wallahi mushkila. I am a doctor. One sister, okay, one lady, when the doctor came in, she covered because she is with niqabi. He got angry. Wallahi, he's shaitan. This doctor is shaitan. He got angry because she covered the face. The lady inside the labor room covered the face. He got angry. I'm like your father. You are not my father. You are shaitan. Wallah, you are shaitan. This doctor is shaitan. And some of the doctors pull the niqab from the lady. Wallahi, strange. Of course, sometimes we cannot do something. Why? Because the lady should go and complain. The lady should go and complain. But she said, why should I complain? I go to the court and khalas. He did the mistake. Allah subhanahu wa ta'ala will punish him yawm al-qiyamah. Subhanallah. What is the point? The point is join your wife. If she's pregnant, join your wife. You should follow up. You should follow up with your wife. She needs your support. Okay, she needs that you remind your wife, take this medicine, do this and do that, eat this, don't eat that. Okay, and also when you join your wife and the follow up, maybe there are some points that you need to remind your wife. Okay, maybe in the appointment, you remember, you tell the doctor, wallahi, she's going more to the toilet. This is important. There is a problem with the bladder, or there is something. Okay, this is normal at the end of the pregnancy, in the 8th, 9th month, but still she's in the third month, and she's going repeatedly to the toilet. No, there is a problem. So you need to remind your wife. And also inside the delivery room, this is good for the giving birth. This is good. I mean the support. Okay, stand up with your wife. Okay, hold the hand of your wife. Okay, of course she will shout you. Maybe she will bite you. not cursing يعني teach please don't curse, say everything but except cursing. طيب maybe she'll bite you, it is painful يعني, it is painful, it is not easy. We يعني, as I said, the problem here, they are not following the rules of Islam and they are not following the rules of medicine. They are not following the rules of medicine. يعني, I mentioned this before, I think many times, there is a subject called communication skills. I remember in the 5th year in medicine, I mean in the medical school, 10 subjects within 1 year. Okay, for example, the first month, yeah, you know, some subjects maybe 4 weeks, 3 weeks, 2 weeks, or more or less. Cardiovascular, respiratory, GI, yani the stomach and the thing. Okay, and one subject, the communication skills. Okay, this is not important. You will not fail this subject. Okay, no exam. Subhanallah, this is the most important one. Okay, but later I think from 2002, they consider this as one of them and we give only 10%. Okay, so even if you don't care about this subject, خلاص, you can't pass the exam out of 90. Very, very important. Very, very important, subhanallah. And now I'm sure everyone, if not everyone, most of us suffer from this point. Well, yesterday, the day before yesterday, okay, my father in the hospital to take some antibiotic. So I called the doctor, there is swelling in his limbs, his hands and his feet. She was saying, maybe this is renal failure, maybe there is a problem in the liver cirrhosis or something. Are you crazy? How come you say this word? Renal failure, do you know what it means, renal failure? Okay, this is wrong. I mean, medically, this is wrong. This is wrong medically because, there are rules for something called breaking bad news. They were teaching us how to break the bad news. The patient has cancer. The patient has hypertension. The patient has a chronic disease. Okay. Then when she went inside and she saw no, this is normal because of the bed. Okay, why did you say renal failure? Why? Subhanallah, for some doctors, maybe cancer. Maybe cancer. حبيبي شنو maybe cancer? This is not مطعم هندي بطاط فلافل, maybe more فلفل. والله some of the doctors, wallahi, they should not work in the hospital. They should not work in the hospital. Huh? Slaughter? No, they should not work any place. Well, this is a big problem. You have to make sure, one of the main points about breaking bad news, you have to make sure 100% double check the diagnosis. Don't say any word. The diagnosis, if you are not sure. Or you are sure, but you need double check. Cancer? For doctors, this is something common. Why? Because every day they are repeating the word cancer, maybe 10 times, 20 times. Renal failure, cancer, diabetes, hypertension. For them, this is something very normal. But of course, they will not accept this for their parents. Subhanallah. I'm talking about medicine. Okay. Women pulled me to the... Okay, join your wife, خلاص, during the delivery. Okay. If you, always I'm recommending, if you can afford the private hospital, okay, pay for the private hospital, wallahi. If it is, if you expect normal delivery, do it. Why? To be with your wife, there is privacy, okay? And you pay sometimes more, maybe 40 KD, 60 KD. They give you the permission, you enter the room. If not you, maybe your mother, your sister, her sister, to join. This is important. This is important. I need a support like that. And subhanAllah, usually they don't care about the awrah. Your wife uncover, because she is moving, it is very difficult. Okay? So she will uncover the awrah. Okay, for some of them don't care, or maybe most of the nurses and doctors don't care. Do you think that she will come and she will cover? Huh? They don't care. Many of them, or most of them. طيب. The last point. What is the what about the blood? What about the bleeding before giving birth, before the delivery? The blood before the delivery. Shafi'iyya and some opinions of the Hanbali and Hassan al-Basri, Ishaq, okay, and Ibn Qudama, Sheikh Sa'di, they said this is considered as nifas, the bleeding before delivery. Okay, especially if there is طلق, الطلق اللي هو like the movement of the uterus, the contractions of the uterus, How can the lady knows that the delivery is close? The contractions of the muscles of the uterus. So if there is bleeding with these contractions, then we consider this bleeding as nifas. And it comes maybe before the delivery in hours, or maybe one day, something like that. For some ladies, when they go to the hospital, they stay in the labor room maybe 12 hours. They give induction of labor, maybe 12 hours, 15 hours, something like that. So if she is bleeding, not if she is inside the labor room, if she is bleeding, we consider this as nifas. Just hours before the delivery. Just hours before delivery. Sorry? Ishaq Rahoya, Hassan al-Basri, okay, Shafi'iyya, and some Hanabla. Also Ibn Qudama and Sheikh Abdul Rahman Nasr al-Sa'di. So this is the end of chapter of purity. I think we covered in details the chapter of purity, صح? How many lectures? You have in the link, huh? 16, 16? Okay. And I think we covered in details the chapter of purity. So do you like next halqa we change the topic, or we continue to talk about in details about the fiqh? What do you like? They got bored, صح? What do you think, Umar? Yes, sure. I know Umar.
He's teaching fiqh, that's why he wants to teach.
Okay. Okay, you should teach fiqh now, خلاص. You should teach. You should be a stud. Okay, you can fight now. Huh? Everyone is waiting. What will happen between you and him? Huh?
For them to fight. So it's another fiqh issue.
Another fiqh issue? Okay, maybe we can change for 1 month, 2 months, then we come back. Okay.
What is next? What is next in fiqh?
I will think maybe. I will see. Maybe I can see something in the dream. Maybe something. خلاص, inshallah. Maybe we can see some suggestions. جزاكم الله خيرا. السلام عليكم.